If you collect SSI, SSDI, or retirement Social Security benefits, there are important updates you should understand right now. The Social Security Administration has now released its official annual 2026 adjustment figures. Although these updates arrive each year, the exact figures matter greatly because they shape your monthly income, your eligibility, and your future financial decisions in very direct and practical ways. Whether you are already receiving benefits or plan to apply soon, knowing where things stand could decide whether you protect the money you have earned or lose benefits you deserve in the months ahead. In this video, we will review each program, every updated figure, and each key step in clear and simple language for easy understanding today. Let us begin with SSI, also called Supplemental Security Income today. SSI is a need-based program for eligible people. It is not linked to your work record or payroll taxes. The program is meant for people who are 65 or older, blind or disabled, and who have very limited income and resources. SSI has always operated under strict financial rules, and one of the most debated limits is the resource cap. If you are single and receive SSI, you cannot own more than $2,000 in countable assets. If you are married, the limit rises to $3,000 for the couple. These limits have not changed since 1989. That is accurate. For more than 3 decades, while housing, groceries, transportation, and medical care costs have kept climbing, the Social Security Administration has left the SSI resource limits frozen at the exact same levels for millions of people. Lawmakers in Congress have introduced proposals to raise those outdated limits. The SSI Savings Penalty Elimination Act, introduced as Senate Bill 1234 and House Resolution 2540, would significantly raise the current caps. However, as of April 2026, the proposal still has not become law. That means the limits remain unchanged at $2,000 for individuals and $3,000 for married couples. Now, let us discuss the number that changes each year slightly. The maximum federal SSI payment for 2026 is $994 each month for one eligible individual and $1,291 each month for an eligible couple. These figures include the 2.8% cost of living adjustment that took effect in January 2026 for recipients. Is $994 each month enough for someone to live comfortably today, really? Most people would probably say no, but it is still higher than last year. And every extra dollar matters when you are living on a tight, fixed income. One especially important update concerns how the Social Security Administration handles what is known as in-kind support and maintenance. This refers to situations where another person helps provide your housing or food. For many years, if a family member let you live with them or helped pay for meals, the SSA could reduce your SSI payment because that support counted as income under older rules. In February 2026, the SSA released updated guidance that changes how some forms of in-kind assistance are evaluated. In practical terms, that means certain kinds of support from relatives or friends may no longer reduce SSI benefits the same way they once did. If you rely on help from family members while receiving SSI, it is very important to speak with your local Social Security office to understand how these new rules could affect your payments. There is another very important issue involving SSI overpayments. If the Social Security Administration decides they paid you more money than you should have received, they will send you an overpayment notice and begin recovering the money from future benefit checks. The standard withholding amount for SSI overpayments is currently 10% of your monthly payment. You have the legal right to appeal the overpayment determination by using SSA Form 561, and you can also request a waiver with Form SSA-632. If paying the money back would create financial hardship, you generally have 60 days from the date on the notice to respond before your checks are reduced. Never ignore an overpayment letter from Social Security. Respond as quickly as possible. Now, let us move to SSDI, which stands for Social Security Disability Insurance. Unlike SSI, SSDI is earned through your work history. Eligibility depends on the Social Security taxes you paid while employed over the years. SSDI is designed for people who cannot keep working because of a medical condition that is expected to last at least 12 months or end in death. For people receiving SSDI, one of the most important numbers to know is the substantial gainful activity limit. commonly called SGA. This is the monthly earnings amount the SSA uses to decide whether someone can work again safely. If your income rises above the SGA limit, Social Security may decide that you no longer meet its definition of disability, which could affect SSDI eligibility status. In 2026, the SGA limit for non-blind individuals is $190 per month. For people who are legally blind, the monthly limit is $230. These amounts are higher than last year and are important to understand if you receive SSDI and are thinking about any kind of employment. Another important protection is called the trial work period. This rule allows SSDI recipients to test their ability to return to work for up to 9 months without losing benefits. Those 9 months do not have to be consecutive. They can be spread across a rolling 60-month period. During every trial work month, you still receive your full SSDI payment. No matter how much income you earn in 2026, a month counts as a trial work month if your gross earnings exceed $1,210. After the trial work period ends, you enter the extended period of eligibility, which continues for 36 months. During this period, if your monthly earnings fall below the SGA threshold, you can once again receive your full SSDI payment without filing a brand new application now. This system exists because the Social Security Administration understands that returning to work after a disability can be unpredictable. Some months may go smoothly, while others may become difficult. The trial work period and extended eligibility rules give people room to try work again without risking everything immediately. Continuing disability reviews are another issue SSDI recipients need to watch closely. The SSA regularly reviews disability cases to decide whether beneficiaries still meet the medical standards for disability benefits. In March 2026, the Social Security Administration said these reviews are now managed internally, rather than being outsourced to outside contractors for processing. Although the stated goal is better oversight, staffing levels within the SSA are currently at some of the lowest seen in decades overall today. That has raised concerns about delays, accuracy, and processing times. If you receive a continuing disability review notice, respond quickly and completely. Submit every requested medical record and consider getting help from a disability attorney or advocate. Now, let us turn to Social Security retirement benefits, the program most people know best and rely on most. The 2026 cost of living adjustment is 2.8% for beneficiaries. For the average retired worker, that equals about $56 more each month, raising the average retirement benefit to around $2,071 per month now. Nearly 71 million Americans are receiving this increase. However, there is something many people fail to notice. The COLA increase can be reduced or even fully offset by rising Medicare Part B premiums. For 2026, the standard Medicare Part B premium is $22.90 per month, which is an increase of $17.90 from the prior year figure. Because Part B premiums are usually deducted directly from Social Security payments, the increase you see in your bank account may be smaller than the announced COLA amount. There is also an important safeguard called the hold harmless provision. This rule prevents your Social Security payment from decreasing from one year to the next solely because of increases in Medicare Part B premiums. Most beneficiaries are protected by this rule. However, if you are newly enrolling in Medicare, if you pay premiums directly instead of having them deducted from your Social Security payment, or if you are subject to the income-related monthly adjustment amount because your income exceeds certain limits, you may not receive full protection anyway. Understanding whether ARMA applies to you is extremely important and worth discussing with a Medicare advisor. If you receive Social Security retirement benefits before reaching full retirement age and continue working, the earnings test applies during 2026. If you stay below full retirement age for the entire year, you can earn up to $24,180 without losing any benefits at all. For every $2 earned above that amount, $1 is temporarily withheld from your Social Security payments. In the year you reach full retirement age, the earnings limit rises to 65 out of 160, and only $1 is withheld for every $3 earned above that limit today. Once you officially reach full retirement age, the earnings test disappears completely. You can earn unlimited income without any reduction in benefits. There is also something many people misunderstand about the earnings test. Money withheld because of excess earnings is not permanently lost. When you eventually reach full retirement age, the Social Security Administration recalculates your benefit and gives you credit for the month's benefits were withheld. That adjustment results in a larger monthly payment moving forward. Deciding when to claim Social Security benefits is one of the most important financial choices you will ever make. You can start collecting benefits as early as age 62, but doing so permanently reduces your monthly payment by roughly 25% to 30%, compared with waiting until full retirement age. For anyone born in 1960 or later, full retirement age is 67. On the other hand, if you delay claiming benefits beyond full retirement age, your payment increases by 8% for every year you wait until age 70. After age 70, delayed retirement credits stop increasing. The right claiming decision depends on your health, financial situation, marital status, and your overall retirement strategy. There is no single answer that works for everyone, but misunderstanding the calculations can lead to extremely costly mistakes. The Social Security Fairness Act, signed into law in January 2025, eliminated two rules that previously reduced benefits for millions of public employees and their families. The windfall elimination provision and the government pension offset are no longer being applied. As a result, teachers, police officers, firefighters, and many other public employees who also qualified for Social Security are now receiving their full calculated benefits. Retroactive payments totaling approximately $17 billion have already been distributed. If you or your spouse worked in public service while also paying Social Security taxes, you should confirm whether your benefits have been properly updated. Spousal and survivor benefits remain some of the most valuable yet misunderstood parts of the Social Security system. If you are married, you may qualify for a spousal benefit worth up to 50% of your husband's or wife's full retirement age benefit. If that amount exceeds your own retirement benefit, you may still qualify even without a long work history, because eligibility is based on your spouse's earnings record. If your spouse passes away, you may qualify for survivor benefits worth up to 100% of the amount they were receiving.